And now the countdown is on. Hartford HealthCare's Heart-to-Heart event is taking place tomorrow.
And women, it is time to put our hearts first. You want to learn to take the steps that you can take to stay healthy, strong, and informed. And joining us today to tell us more is Dr. Heather Swales. She's the medical director of Cardiovascular Medicine at Hartford Hospital. Thank you for being with us.
Thank you for having me.
So why is women's heart health still so often overlooked? And maybe what are some of the common signs that we as women might miss?
Great question. I think there's a historical lack of research and emphasis that's been placed on women's heart disease. And a lot of women, as well as healthcare providers, don't realize that heart disease is the leading cause of death in women. And interestingly, although chest discomfort or chest pain can often be the most common symptom, symptoms in women are often subtler than they are in men, and they can also present with other symptoms like trouble breathing, nausea, extreme fatigue, sweating, pain in the jaw or back. And women will often blame that on other things like indigestion, stress, or anxiety. So they are not thinking that it could be their heart.
And Dr. Swales, what makes the Hartford HealthCare's Heart-to-Heart event different, and what can attendees expect to experience there tomorrow?
So it's a really fun event. We've been doing it now for over a decade. I think it's unique because it really brings people together, loved ones, friends, family, colleagues, where women can socialize with each other. We have education about heart disease with a focus on women and heart health. And then we have an amazing entertainer, Gina Barreca, to make people laugh. She's an author, writer, professor, and is very, very fun to listen to.
And so what are some of the biggest misconceptions you think that women have about our risk for heart disease?
I think a lot of women, as I mentioned, they don't realize heart disease is the leading killer. And so they think it's a man's disease. A lot of women also think they're too young to have heart disease. They frequently blame symptoms on other conditions or stressors in their life. And I think because of the symptoms are subtler, it is a little bit more challenging often to identify heart disease as a problem.
All right, Dr. Heather Swales, Hartford Hospital Medical Director of Cardiovascular Medicine, thank you so much for joining us, and we hope you have a great event tomorrow.
Thank you very much. Have a great day.
Thank you. Important information. We need to know that sometimes those subtler signs have to be taken seriously. For more information, go to hartfordhealthcare.org/heart.